It's 5:15. I'd like to call this regular meeting to order. Recognize everybody in the audience this evening. Would you please stand and recite the pledge with me? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Moving on to school board norms. Diane, would you like to read those?
Yes. The board developed norms are to share and respect varied opinions and speak with a united voice once a decision has been made, to prudently prioritize resources in a student-centric manner that aligns with the district's strategic plan, to exhibit a mindset of continuous improvement through adequate preparation for meetings and a commitment to board education, to commit to assessing board effectiveness to ensure high-quality governance for the staff, students, and community of Jamestown.
Thank you, Diane. Moving on to public communications, we have none. Any conflicts of interest to declare? Hearing none, moving on to consent agenda. Motion to approve. Motion by Bob, seconded by Aaron. Any discussion? Hearing none, assuming roll call vote, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving into our regular meeting under recognition, we have two board members for recognition. Heidi, would you like to read those?
Yes. We have two certificates of training here, and these will certify that Aaron Roberts and Gail Nelson attended the new member seminar sponsored by the North Dakota School Board Association in October 2020, thereby fulfilling the requirements under North Dakota Century Code 15-1-09-32.
Okay, moving on to the fall activities. Jason, would you like to read those? And then when your name is called, if you want to come up, we have a little appreciation item for you.
Okay, thank you. We'll start with cross country. Megan Ford, state and WDA champion, all state and all conference, NDHSCA Powerade Outstanding Senior Athlete of the Year. Brooklyn Nygaard, all conference. Ben Antow, all state, all conference, third place at state. And Gavin Hout, all state, all conference, and sixth place at state. Moving on to boys tennis, Gage Orr, all conference, Ryder Pringle, all conference, and fourth place doubles in WDA. Boys soccer, Jay Kupitz, my apologies if I said that wrong. All WDA and second team all state. That was boys soccer. Girls golf, Tracy Gustafson, WDA Coach of the Year. Volleyball, Grace Hagerly, all conference, all state first team, and North Dakota Powerade senior athlete. Ella Roldson, all conference, all state first team. And Rachel Sheely, all conference. And football, Matt Anderson, all conference, all state second team. Ty Munson, all conference, all state second team. Damian Krebs, all conference. Jacob Hilgeman, all conference. And Preston Kraber, all conference.
Thank you.
Okay, moving on, we have nothing under correspondence. Moving into reports, Central Valley Health, Robin and Deb.
We'll give it the test, 1, 2, 3, make sure you can hear me. So thank you for having me this afternoon. Central Valley was asked to come and provide an update on the pandemic efforts. So I have provided a written report, and I think that was forwarded out. I will just summarize what is on this report today. We have been at the pandemic response since March of 2020. So we're excited that Central Valley can anticipate vaccine will arrive in North Dakota in the next couple of weeks. A little bit on the estimates of vaccine and who will be first in line. We anticipate that it'll arrive in North Dakota on December 13th with 6,825 doses of Pfizer vaccine arriving. The following week, 13,000 doses of Moderna and 78,100 doses of Pfizer. So where will the distribution of this vaccine go? So we're anticipating that healthcare workers and long-term care residents will be at the top to receive vaccine first. Currently, the vaccine is not licensed for children or for pregnant women. Teachers are listed as essential workers, and they are on the Tier 1B section for vaccine distribution. Healthcare workers are scheduled to be the first priority center to provide the vaccinations for the general public. And while we are waiting, we will continue to have to wear our masks, practice social distancing, staying home, and avoiding large group gatherings. So a little bit about our positive cases in Stutsman County. We have seen some spikes when school started and throughout this fall. We are seeing a little bit of a decrease right now. I believe that's in part to some of the mitigation measures that our community and state has been putting in place. And so we thank our governor and our local mayor for those mitigation measures like the mask mandates. Testing, we have exciting things happening with testing as well. We have the new Binex Now rapid tests that Central Valley has started to use in our community. We have the National Guard assisting us. They have been extended now through March of 2021. We plan to start testing more often in the community, probably daily at the Civic Center, and we will be using the Binex Now for those symptomatic people that present. So we asked you to provide us with some questions, and so I prepared kind of a question and answer, so I'll start with that. So the first question is, are masks alone going to be enough to prevent exposure in crowded conditions? And is that best practice? So unfortunately, no, masks are not alone, do not prevent exposure. The research shows that wearing a mask prevents spread by 40%. Wearing the mask, social distancing, limiting the amount of time you spend in congregate areas are the best ways to reduce spread in school settings. And I know that that's difficult to accomplish that in school settings. And you have to remember that you have to do what you can to try to prevent the spread, and you have to work with what you have as well. Some things you can do would be letting class out at different times, staggering lunches, and so on. And I know that you're already doing many of those things. So is that best practice? And maybe you don't want to hear this, but the school is the safest place for kids to be. We know in North Dakota that there is a rise in neglect and abuse and problematic behaviors in children. So we want to keep kids in school as much we can because it is the safest place. We all know that. So is wearing masks best practice? Yes, it is. Not having enough space to keep kids at a distance? No, that's not a best practice. But again, we need to be creative about what we do to protect our kids so they can be in school. So how do we explain all this transmission in the community? People say, I've only been at school and I've only been at home. And we hear that too at Central Valley. People wonder how they pick up COVID all the time. We know that it is in the community. Maybe people aren't always as honest as they might say they are about where they are or who they've been around. But what we do know that when we investigate cases, or when the state does, they track, where people have been, and they try to narrow down those places. And we do recognize that there has been limited spread within our schools, but there is lots of spread in the community, and we can't always pinpoint where that is. So what about the potential of increased spread from holiday gatherings, and how will that impact our schools, and what can we do? So again, we heard a lot prior to Thanksgiving, and we'll hear it again prior to Christmas about what we should do to stay safe over the holidays. Again, that's wearing masks and limiting where we go and keeping our social distancing. Again, being tested is another method that we can do, especially now that we have the rapid tests. There aren't any silver bullets. We just have to keep going with our approach until everybody can be vaccinated and we find that 70% herd immunity. Testing at the schools, I wanted to mention that a little bit. You are hearing more about that. The testing plan that's happening in the schools is not the same testing plan that Central Valley is working with. These testing plans in schools are being done in a different way, in a different process than what we're doing. And Central Valley would not be part of any testing process in the schools. Those are handled completely independently. They are actually teaching the school staff how to do the Binax Now testing in the schools, like in Fargo. They're currently piloting those programs. So we are lucky, you're lucky that you have a provider that has a rapid testing that you've been able to use for your staff. The testing that'll be done in the schools, like in Fargo, is for the staff only. This is not testing every student in school. That's not what it's designed for. It's designed for weekly testing of staff to identify those positives and have them stay home. So if that is something you're interested in, you would have to work with DPI to find out how that could be incorporated into Jamestown Public School. And then as far as what the school can provide to Central Valley, I think it's just reinforcing those reminders of wearing your masks and staying home when you're sick. We are seeing, when I go to the testing events, people come, they are sick. Many times they are negative for COVID. We're seeing other illnesses, which just complicates what's happening and not knowing, what is it that I have. So you have to really, go get tested to find out if it's not COVID, then taking a different approach to help keep yourself safe and well. So the next question was a little bit about the trace contacting work that we have been doing with the school system since the beginning of school, and I will ask Deb Fisher to come up and summarize that.
Thanks. First, I have to say thank you, and I think me and Sally talked to each other today as far as our outfits. Our golden pants, right? And skirt. So you all were able to see this outline that I had made that was requested? Okay, it might not look like much to you, but just to start this out, I'll ask for your questions. But these three different scenarios are usually what happens, and I did figure out some numbers based on the hours that I would be working in the schools, 4 hours every day, based on 66 days so far of school. That would have been about 264 hours. Being available to the schools and working with these guys, I consider we have a super team between me, Mr. Leck, the principals. There's one secretary that is involved with a lot of calls that she takes. That has put me at 637 hours already. Okay, so that is 373 hours over what would normally have been the 264 hours that we've already, time that I have spent, done, helped out in the schools. So that's my hours. Imagine what your principals and staff doing this their hours are. I don't know what that is, but many details to this, and we've done lots of Lots of work together, multiple questions. The state calls me. I'm the point of contact. Call Mr. Leck, let him know and the principal know, and then we discuss and figure out what we can. There are times because of our testing where we get that report. Robin will download it so I can see it right away, and I'll go through and formulate it so I can figure out ages. And then I look up, fortunately, I have Power School access, being the school nurse. Many areas around the state don't have, their nurses don't all have that or that access necessarily. So I can go in and check for staff. I can go in and check for these students based on age and give them a heads up that these kids shouldn't be in school. They are positive for COVID. Parents should be notifying you. If they do show up, please send them home. Okay? There are some people based on the directives that don't, maybe don't quite understand that they should be staying home if they're waiting for results. And so many a times we have had instances where staff or students have actually gone to get tested and then continue to go back to school. And that's kind of where we end up finding or seeing a lot of our in-school contacts, is because someone was in their infectious period, okay, and went to an activity or came to school and so forth. Okay, Mr. Leck, wouldn't you agree? I feel we see a lot of that.
Yeah, I think it gets better every week when
Yep,
people.
because people are learning more.
Yep, and people are becoming more familiar with expectations. I think in almost all circumstances, it's just people not thinking.
Yep.
You know, or not asking the question, and then we clarify, and then it's clear. But sometimes there is that exposure
Yep.
during
And
the school day that we deal with.
Fortunately, I have that connection with the state and that state system too, so that I can find out or clarify dates and interview systems for them. Believe it or not, I mean, like was stated earlier, there are people that don't state everything that we might know, okay? Whether they're interactivity or a practice or a sport or something like that. And there again, people have said that there's lots of different rumors that go around, don't get tested, because then you won't know if you're positive and you won't have to be out of your sport. Another thing that was brought up at one of our meetings was, what about these kids that feel that pressure, that are sick, that aren't testing, that kind of would like to because of that also peer pressure, team pressure, parent pressure, whatever it is to continue. You know, so can I ask if anybody has any questions looking at what we have been doing in the format we've been doing it in?
Just a comment, you'd have that in your email. It wasn't attached, but you do have it in your email, the report that was referenced by Robin and by
Yep.
Deb.
Because these guys put it on their spreadsheets once the investigations are complete with masked. How many total, how many were masked, okay, because that's a statewide mitigation strategy. And then were they affiliated with any extracurricular or sports activity? And that's new in the last 7 days or so, that they want us to track and have that data in the system. So they, each individual school puts it in their spreadsheet. I can actually have access to that, or I call the principals, okay, and verify those numbers. And then I'm responsible for putting that data into the Department of Health system, okay, for data for the governor. So there might be some things that I do that you guys don't realize that we're responsible for doing, so.
Heidi, you had a question?
I just want to thank both of you and Central Valley
Yeah.
for everything that you do to help the school district and the community. I know that you've, since March, have put in tremendous number of hours, not just for the school district, but for your jobs overall.
Thank you.
Providing
Appreciate
public
that.
health. So
Yeah.
thank you for the long hours.
Thank you.
Jason?
Yes.
So Robin mentioned that staff, teachers are considered essential workers, and a tier B something or another. So is there a potential time frame that our staff could be expecting access to a vaccine?
Yeah, I think, yeah. So as I mentioned, I should have mentioned, I guess, there are 68,000 healthcare workers in North Dakota. The first few doses of vaccine we get will be well under those numbers. So but We anticipate moving through the tiers quickly because we know people won't all want to take the vaccine and different things like that. So we, as soon as we find those things out, we will be contacting the schools and the list to let people know what's available.
Okay. And any idea, like when there will be, you may have no idea, but like one for the children, is that, you said that hasn't been approved yet. Do you kind of have an idea of what's going on there?
So I get this kind of the same stuff as all of you through the news. So what the news is saying is that I don't remember which company, might have been Johnson & Johnson, that they were working on getting FDA approval for children. They've done some clinical trials with 16-year-olds.
And sorry, last question, but the testing going on in Fargo for staff, is that the same? I've heard this term surveillance testing. Is that what that's referring to?
Right. So they're testing people at regular intervals every week. They're asking the teachers to test.
Rob?
I think there's 3 districts that are piloting that. It's Bismarck, Mandan, and Fargo, I believe, correct?
Yes.
So those are the pilots. I was just going to, if I may, make a comment in appreciation to Deb and Robin, but I'm sure that the board recognizes too, Deb talked about her hours. Some of those hours were CARES funding supported. So we know that CARES funding ends at the end of this month, which means some of that support unfortunately ends as well. And I think we will find out in early January just how much we've come to depend on those hours. And so just an appreciation for both of you and for the organization for all that you've helped with us. And we absolutely recognize how much work that you've put in and supported our kids and our staff.
Thank you.
And us as administrators that have had to deal with it. We've become very close.
We
Yeah.
have.
We talk a lot.
We all do, yes, we do.
Heidi?
Robin, can you just talk about the rapid testing and how that works?
Sure. So the rapid testing, compare it to a pregnancy test that you buy at the dollar store. So basically it's a card. You swab the inside of your nose and you put it in the kit. You wait 15 minutes. If it's positive, then you will have the results right then and there. So that's how it works. It's, like I said, most effective for those that are symptomatic. And if you do not, if it's negative, you need to follow up with the PCR test, which is the gold standard test that's sent to the state lab.
Gail?
I have a question. I had heard earlier that those tests were not counted in the daily counts. As they become more effective, will that start to be rolled into the state's daily positive numbers, or where does that stand? And and if they're positive, they're still reported back to the school, correct?
Right,
I
so
just have
they're
some
still
confusion on
counted.
what I'm hearing with that.
Yeah, I'm not sure where that's coming from, but when we do the tests, we enter them directly into the state system. We enter the positive results. It goes right on up, and those people are notified to the state epidemiologist, just like any other of the tests that we do. And then they're called by the contact tracers as well.
And just as an example, she did a couple this morning, and by this afternoon, I had the results. All the data facts of the interview and the exact dates of onset infection and so forth, and that went to the school at 3-something today,
Well, and thank you.
from 10 o'clock this morning. So that's pretty nice.
That's,
to be
thank you.
able to-
And that may have been earlier when they weren't as effective as they are now, that they were
Sure.
having them do a retest. So thank you for all you do.
Yep, thank you.
And also, is it definite, and that might be for you, Rob, is there anything we can do to help support, get those CARES dollars renewed? If we're not all vaccinated until May, I don't think our need will stop when they run out. So anything that you would recommend that we should do to help continue to get supports for our school district and our Central Valley staff?
I think just continue to advocate with our legislators that there's needs beyond December 31st. I'm hearing more potential packages coming, potentially extensions, although the longer that delays, the less hopeful I am. But I think there's a lot of folks sharing that needs don't end on December 30th. So I think that there's a lot of work in the pipeline, but just continuing to talk to legislators and policymakers that we need additional support beyond the 30th of December.
Any other questions for him? No? Okay, thanks for coming.
Thank
Yep.
you.
Thanks for the information.
Yeah, thanks.
Student council report. They weren't, okay. Okay, moving on to activities winter guidelines. Jim?
Good evening. Thanks for having me here tonight. And I guess before we get started on the winter activities, if you'll indulge me here, I would like to talk a little bit about fall activities very briefly here first. Some good news, first of all. We did get word here, all of our varsity teams have qualified for the North Dakota High School Activities Association Team Scholar Award. So every one of our fall varsity teams had a team GPA of at least 3.2 or higher, and that's something to celebrate. So congratulations to them. Fall activities overall, considering all the unknowns that we had to deal with and everything else, we would view them as successful. Our goal at the beginning was to allow our students the opportunity to continue to practice and compete. If we take a look at where we were back in March, that was kind of a credo that we kept hearing, was that we just want the students to play. We just want to give them a chance to play and do the things that they enjoy. And I think for the most part this past fall we were able to accomplish that. And some activities were a little bit more prevalent and a little bit easier to do that than others, and some had some huge obstacles to kind of overcome. But overall, students were able to continue to do the things that they love for the most part, and that was great. Fine arts, in particular, continued also to be a challenge during this time as well. Our music department had to rely mostly on small group instruction and small group work, and did have to make quite a few accommodations for large group sessions, and whether it was in the commons to allow them the opportunity to come together as well, or utilize the gym, or even go outside. So unfortunately, they were one of the particular areas that did have a little bit more difficulty in being able to combine and come together and do some things. But they were able to do some things. That we also had the challenge. We had a new advisor and new teacher in that role too. That obviously none of us have ever seen this kind of an instance before, but didn't have a lot of experience to draw off of either in this situation. Drama was another area that they made some accommodations to be able to practice and prepare their production. They did so very well, but due to some quarantining taking place and not being able to have everyone together at once, they did decide, Mr. McIntyre and the students together chose to delay a performance to another time. So down the road here, we will see an opportunity for them to perform again, and that was something that they collectively made the decision to do. Some numbers I wanted to share with you from North Dakota High School Activities Association from fall activities. It was shared with the membership school here via Zoom here about a week or so ago. But with high school activities numbers, 100% of, before I get into that one, there were no programs statewide this past fall that were shut down completely by COVID-19. But what I mean by shut down completely is that they did not have the opportunity. Once they made a decision, they totally shut it down, and we're not able to practice, we're not able to compete, and just chose not to do that anymore. So that was encouraging. 100% of the individual sports teams, sports like golf, tennis, cross country, and girls swimming and diving, they were all able to finish their season completely without any lost contests. If you take a look at an example, a girls golf meet or a girls golf tournament, it's it's your social distance by nature with that you a lot of room to cover, and they can spread out and space out. So they were one activity that other than just around the clubhouse and as they got started and maybe changing what they would normally do for an awards ceremony upon the conclusion with results and so on, their activity went pretty normal, or pretty on cue for what it normally would look like. So it was good to see that, and for them to enjoy that. But as I said, tennis, cross-country, swim and dive, all those were able to complete their schedules, which was really nice. Altered, yeah, fan attendance at some things. As an example, state swimming and diving meet was looking at potentially not even being able to have fans in attendance at the state meet. It was scheduled to be in West Fargo, and the High School Activities Association, probably about a week prior to that, decided to move it over to Bismarck because in working with the counties and the facilities and so on, public health in the Bismarck area would allow them to do that with some minimal fan attendance and so on. So the High School Activities Association made that choice to move that over. We were affected here locally too with state cross country. Class A and Class B boys and girls state cross country is usually a combined event. But based on our public health here and numbers and so on, there was another county that had their numbers were down. They were still actually in the blue at the time the state cross-country meet was to be held. And so it was made a decision to split the Class B and the Class A. And we held the Class A meet here. And Class B meet was held up in Cooperstown at a golf course up there. And we were effective in being able to provide those opportunities for those students. So and also allow a certain amount of fan attendance for those people. So that was a success there too, if you base it on kind of where we were at times. But 93% of team sports this fall were also able to complete their season without any shutdowns due to COVID. Soccer teams across the state, 93% of those teams were able to complete their season. 14 out of the 15 teams statewide were able to do that. Football teams, 93% of the football teams across the state of North Dakota also were able to accomplish that. 95 out of 102 teams statewide were able to basically complete their entire season without any kind of a hiccup along the way, other than I'm sure maybe a few isolated quarantines here, or a few positives. At least the team wasn't shut down or they did not lose contests. Volleyball, same thing, 93%. 114 out of the 122 teams statewide, same thing. They were able to complete their schedules without having to do any reschedules or canceling and those kind of things. So statewide, all teams, again, 93% were able to complete their entire fall season, which is 223 teams out of 239. So collectively, a pretty much, a success as you look at it from that point of being able to offer these things for our students. Locally, we had some individual students that did test positive, as well as having to be quarantined. We did have to quarantine one team early in the fall here in the process due to a positive test, and we made a decision not to allow our football team an opportunity to compete in a playoff game due to some pending COVID tests and the numbers of close contacts that we had in that situation. And as it turned out, it was a situation where we, after we made that decision, within the next week or two, we probably had about 12 to 14 positive cases that ending up and resulting within that program. So we feel that the right decision was made at that time, as tough as it was to make that decision. One of the questions that was brought forward prior to this was what was the kind of the timeline of the High School Activities Association recommendations as things evolved here this past fall. July 24th basically was a date that the High School Activities Association established their guidelines and expectations for member schools and made that public to all of us, and gave us a working document to kind of work within the framework here for the fall sports and activities. On September 10th, they provided us with an update which basically established wording as far as fan attendance and participation was going to be up to the local school districts to determine, and working along with their county health department. That was probably the biggest change from the update in September 10th from that original July 24th date. And more recently here, November 24th update, this included some additional winter activities and changes based on our governor's executive order for us to basically shut down activities as far as practices and competitions, and also gave us some other direction on sports-specific type of things. Along with that, fine arts were affected. The number of schools competing was a recommendation that was made by the help of CSTAN, that stands for the Communication, Speech, and Theater Association of North Dakota, the Restart Committee. They work closely with High School Activities Association, determining, going forward, what should speech look like this coming season and those kind of things, and how do we do that, whether it be in the Class A or Class B ranks, and get that accomplished. So they came up with a standard as far as the number of teams that you can have in an event and so on, and work closely with them. And then through, obviously, some further consultation with entities such as North Dakota High School Activities Association as well as County Health, that revision was made to allow teams, again, from the governor's original executive order, allowed us to begin practicing again on November 30th, with contests to resume on December 14th then too as well. I got ahead of myself there a little bit. In January here for the fine arts too, the high school activities will be planning for their culminating competitions in speech and music. So there will be, for lack of better terms, a postseason for these activities as well. They look forward to these end-of-year festivals and competitions, and so high school activities has every intent to try to make that a possibility. There are some obstacles overcoming. One of them in the area of music right now is what schools and what universities are willing to allow these competitions to take place on their campuses due to the number of people that will entail and so on. So kind of wrapping up the fall portion. As I said, winter activities, right now we're scheduled to begin on time originally, but again, due to Governor Burgum's executive order, we did have a delay, a brief shutdown, and through, again, further consultation with high school activities, our county health, and some other entities, the revision was made for us to resume, and again, next Monday then would be the first opportunity to begin competitions again for those activities. What have we done? We've modified our schedules accordingly, as well as updated daily practice protocols, and we'll continue to look at fan attendance policies. That's something that, really throughout the entire process of the fall, it was ever changing. It will continue to change as we go, for the better, for the worse, as we go, whichever way it happens. Currently the agreement with WDA schools is to allow for no more than 50 home fans at events. Is kind of our standard right now for the winter events as we go forward. As I said, that could always change here for the better, could change for the worse if numbers show that. This number does exclude the student athletes and coaches, officials, and the essential game workers that were involved. The numbers that we used for this past fall to determine fan attendance did include every participant, every game worker, every official, and so on. So we were given a little bit more latitude with that, and just focus more on what that number of fan attendance wise is. We're still encouraged to keep rosters to a minimum, keep people, take every precaution, especially in contests. You still want the social distancing and spacing. There are some deals with as far as the masking up and so on. There's still requirements to do that on a daily basis in practice and so on, but in games and game format, basically a general rule of thumb is you mask up. If it's exhaustive type of activity, then obviously the masks need to come off as a health concern. So a lot of your winter sports, your competitions, you're going to see where students are not mask to mask during the competition, but on the sidelines, they will be masked. You'll see coaches masked. You'll see, again, officials will be masked up. Table workers, those kind of people will all be masked up as well. Obviously, the fans in attendance too, en masse. Almost all facilities now in the WDA will have the ability to live stream events, so that parents and fans that are not able to attend contests should be able to watch it live streamed without being there in person. We are scheduled to have another meeting here as WDADs and a Zoom meeting here this Wednesday to further talk about our upcoming season here yet, as obviously we are getting very close to beginning competitions again here on Monday and Tuesday of next week, so we can kind of make sure that where we're at, what everybody's doing is kind of where we want to be, and if we need to adjust to any last minute numbers to make those changes. And I'll continue to be working with our winter coaches to determine this week how we're going to look at regulating or determining our fan attendance and who is allowed to attend and so on. Our numbers, as I said, right now we're looking at 50. Obviously, with some sports, you have multiple levels, varsity, JV, maybe even sub-varsity type of things. So, when you use that number of 50, it's probably not as pressing at the, maybe, I'll use basketball as an example, maybe not so as pressing as a sophomore or junior varsity level as it will be at the varsity level. So determining how we're going to allow fans to attend and so on, we're going to be working with our coaches to get that figured out. So, and again, we are trying to do everything we can. We're very thankful that as far as the fine arts and the music and that, a lot of that is curricular by nature. Being back in school with all the students on a daily basis has allowed us to be able to bring these groups together again, and that's great to see. Our advisors and teachers, instructors have done a great job of continuing that social distancing and trying to figure out ways to, for lack of better terms, to put that square peg in a round hole. So I'm very thankful for them, and again, thankful for our school board here and our school district, and the help of our county health here too. We've worked very closely here with Deb Fisher that just spoke a little previous here to me, and she's been a very valuable asset to us in this process. So thank you. With that, I'll entertain any other questions that you have.
Any questions for Jim or Bob?
Yeah, a question on when you have multiple games in an evening. How are you, what are you doing about rotation of fans? Let's say you got a 3-game sophomore JV varsity. How are you handling that to keep the fan number at that 50?
That's to be determined yet here this week. That's what I just said. We want to work with our coaches and so on, because, it'd be very easy to say 50 fans, period. So at the varsity level, we have maybe, I'll use varsity girls basketball, they might be dressing 15 students. So if we give 15 students two passes each, we're up to, we're up to 30. If we give them 3, there's 45, we're at our limit. So, we don't necessarily want to say just varsity only. We might have to. But at the same time, that's why I want to get some further talk with our WDAADs here on Wednesday.
Any other questions for Jim or? None? Okay, thanks for coming, Jim. Oh, Heidi, you have one?
So at one point, something was released with the color designations that equates to the number of fans. Are they still going with that, or is that maybe subject to change also? There was a school that early on in the year that our fans were not able to attend the girls' swim
able to attend their function up there, I thought it was important to allow them their parents to come down here as well, because ultimately, we're servicing students. You know, whether or not they're Jamestown students, obviously that's our role, that's our job, but when you take a look at activities as a whole, they're all students. They're all our North Dakota kids, and we want to help them and their families. So, you know, we did allow that particular school, their visiting fans to come. Later on, we had to adjust and we had to be consistent with everybody, and we chose to do that and shut some things down. But ultimately, we were able to kind of go a little bit different, and I think that did cause a little bit of confusion for some people, and I think that preempted the decision of the WDA then to, we need to be together on this, and we need to be consistent. And I think the recommendation also came out a little bit later that, you know, whatever you go with fan attendance, you use the school, the competing school, the most restrictive. It's kind of a rule of thumb to use. So with that, we kind of felt that, you know, everybody being consistent with WDA is probably best for everybody. So, okay.
No other.
Anything else?
Gail?
I just wanted to thank you for the live streaming and things that you've done. That's brought a lot of joy personally to me to be able to see these games and be a part of it that way. And I know to many grandparents who I've talked to and other people, to give them that access still was really appreciated. And I know it isn't always as easy as it looks. So thank you.
You know, that's one thing I hate to say too. You know, there are some good things that have come out of this process. We've learned as a coaching staff to look for positives. We've made some adjustments in training and some practice, how we go about things. And some of the things that we've done are going to stick around with our teams and with our coaches. So that's some positives to take away from this experience. So again, thank you very much for having me here tonight.
Heidi's got one more question.
Yep. Sorry.
I just wanted to thank you for reporting not only on athletics, but activities as a whole as well. So I appreciate the whole picture. Thank you.
Thanks for coming, Jim.
Yep, thank you.
Moving on to superintendent's report. Rob?
All right, thank you. You have my written report. I'll go through some items a little bit more than others. If you have action items for some, I might wait till action takes place. But our instructional plan review team met recently, and so our recommendation to the board is to continue with our current instructional plan. And just as a reminder, we added that. You know, now we have 5 instructional plans, so maintaining the same plan we're in now, 5 days at the elementary, 4 days at the middle school and high school with the virtual day on Fridays. That is our new instructional plan too, so that's the recommendation. The team extremely encouraged by the numbers that we see, that we have been seeing. They've been continuing to dip, which we feel very good about. We also know, however, that we're concerned about the impact of holidays, what happens after the holiday season. We know that our numbers, when I reported on Friday, are not all that dissimilar from where our numbers were at the beginning of November. And we saw a pretty significant surge around the 13th was our high point. That is not coincidentally 2 weeks after a holiday and a large congregate gatherings of Halloween. I don't think that is a coincidence. So the group was cautious, optimistic, but cautiously optimistic. Anecdotally, I can tell you from what I've seen and heard that I think our community and our state was heeding and listening to the concerns coming from the state in terms of practicing better mitigation strategies, maybe still meeting, but meeting in smaller groups instead of larger congregate groups. I think that we will see benefit from that. Again, that's anecdotally, I don't know that, but I do know that this is the week that we'll start to see a little bit of a surge again. And you compound that again with activities starting again, and there's going to be impact. And our activities are important, and you just heard a lot of information about how important those activities are. And I support that, and I'm not in any way suggesting that activities should not take place. They absolutely need to for our kids. But they are different. The rules are different, and Mr. Rolson stated this earlier. We've learned a lot our coaches have learned a lot. And you see, our coaches are very mindful and purposeful of how they're organizing their practice plans. That's very encouraging. There's still going to be impact, and that's going to be a different impact than what happens in Algebra 2 class. But I am hopeful that our numbers will continue to stay lower and that our mid-November surge was the largest spike that we'll see, because that is obviously the trend that we want to continue. But we will see uptick this week. That's almost for certain. And we just need to continue to be vigilant. Our team expressed concern, even with really good numbers, about making a change prior to holidays. We know we're going to see a Christmas break with, again, congregate times, and we're hopeful and appreciative of those community members that practice those mitigation strategies and that make those little sacrifices during the holiday seasons. As tough as that is, it was tough for my family. I'm sure it was tough for everybody's family to think of the holiday seasons in a different way. But anecdotally, that seems to have been the case, and we hope that continues in the Christmas holiday and the New Year's holiday. But the team was concerned about making any kind of change, even with good numbers. It felt it would be premature to do that prior to the holiday season. You've seen the impact tables. I wanted to reference just a few changes. Deb Fisher referenced them just a bit. Now activities. We've been collecting activities data since the outset. So that isn't a new thing for us, although it's a little bit more investigating than we were doing before, but it's nothing our administrators couldn't handle. It's a few more questions. But we do need to now report those activities through Central Valley Health. They make the report to the state level as well. One other change that's fairly significant is CDC guidance on quarantine. We know that has been 14 days. Now, that it is still 14 days for a close contact designation, but a student or a staff member is allowed to come back to school after 10, assuming they are asymptomatic. Okay, so that shaves 4 days off of that quarantine, gets kids back in school, gets staff back in school, which we think is a positive. Again, as long as they are asymptomatic. If families or students or teachers are symptomatic, we want them to continue to be at home. We've seen the trends of that already with positive cases or symptomatic cases where we see sometimes that 10 days is 10 days, and sometimes it's 15 days, and sometimes it's 20 days. It's different for everybody, and we just have to manage those things. But 10 days is allowable now as long as that person is asymptomatic. That could be fewer with a negative test as well. It's a little bit problematic, though. The guidance has not allowed for rapid testing to be used, so timing makes it very difficult for it to be any less than 10 days. But even with that, 10 days, that's an additional 4 days that kids can come back to school and our staff can come back to school, so we think that that's a positive change as well. I shared the tables that I shared last Friday. I do these Monday morning, Wednesday morning, and Friday morning, at least 3 times a week. Sometimes I do them more. But as I said, we can expect this week to be a little bit of a surge. We're seeing that already in this week. But overall, like I said, things are looking positive. Board meeting calendar revisions with the change to the instructional plan process. I think it would be wise. Traditionally, the board has not had 2 meetings in December and January because of the holidays. I think it would be wise for the board. My recommendation is to have a meeting in December because you are now responsible for the instructional plan decisions. I think it would be a bit tone deaf to not have a meeting and to at least review. That would mean you would be meeting in about a month span without acting on an instructional plan. Revision or potential revision, I think it would be wise to do that, even if you have a short meeting scheduled for the 21st. I think it still would be wise to do that. So that's my recommendation. I'm also recommending a board retreat on January 4th, and then we would have our board meeting on January 18th. So if the need arised, you could have a short board meeting on the 4th as well, prior to that or after the board retreat. And so you could act on an instructional plan at that time as well. And I think you would probably know more based on the data that comes in, if you'd want to do that or not. But I would find that to be a reasonable plan moving forward. Last meeting, I should say, I provided a budget for resiliency grants and education corps. Heidi and I are part of the communications committee. One of the areas that we had some good discussion around was impact at the elementary. And so we're still looking at some strategies there. We've asked, we're having another meeting. Now, I didn't include that in the budget areas, and I don't foresee it being a large expenditure item. But unless there is direction opposing that, I am asking for the board to give me a little bit of flexibility there to address what I feel is a potential inequity at the elementary level and monitoring classrooms, lunches, things of that nature. Well, I just have some, if there's, I guess it would be my plan to do that unless I'm told differently, and I can always bring that forward at a later date, but I didn't want to suggest to do something that I can't deliver on. But I think it's an important area that we need to address. There is an inequity there, and I think it's important that we do that.
Jason?
Well, yeah, thank you for doing that. My only question around that is, would this be retroactive? I know that would be a pretty heavy lift to figure all that out, but.
It's something that we're talking about. We asked in the communications committee to look at some potential solutions. The purpose of those meetings are solution focused. We address problems, but we don't admire them for too long. We want to focus on actual solutions. So I think there's going to be, it's the 21st. 21st is our next meeting, so we'll hopefully have some discussion points at that time as well. But it's something that I think that we at least need to try to address.
Bob, do you have a question?
Yeah, just thinking about policy, the position that you're talking about hiring would be support staff, right? It wouldn't be professional?
I'm not sure I follow. I'm not necessarily talking about hiring an additional person. That may be a solution that we come to. But I think there's a few different ways that we can look to address the issue. We just need to do it in the right. We've talked about a few, and none of them seem to fit the bill in terms of addressing the root of the problem, which is time. And so if we can find a solution that addresses that, then we'll try to do that. But what I'm talking about isn't necessarily hiring a person, although that might be the solution we come to. We have not found a solution yet. I'm just bringing it up as a potential item that I did not bring up in my budget that I'd like a little guidance on, if that's an area that you feel comfortable with in resiliency grants and education corps funds. And again, my purpose is just, I think there's an inequity there that we need to address. Okay. Virtual Academy, we've done we've sent out our surveys. Well, I shouldn't say our surveys, our registration to opt back in and opt back out. It's about a wash. What we're seeing, actually, we're seeing more students come back in if you consider the first quarter than we're seeing go into the Virtual Academy. There's been about 5 families representing about 8 students, not all of those who are registered here. Some are not registered here currently that want to move into the Virtual Academy. Like I said, we're seeing far more students come back in to the traditional setting than we are seeing moving out. I want to touch real quickly on the last thing I had that I wanted to touch on was just a note, the tuition agreements. You see there's a large number of pre-K students requesting tuition agreements. That is public pre-K, all kids. We have only special ed pre-K. And so when we see those tuition agreements, that is for pre-K, public pre-K for all students in another district. We don't have that service. And just wanted to outline that specifically. But with that, I would stand for questions.
Any questions, Rob? Jason?
Just one thought I had was, we're kind of in a unique situation with UJ students who might be student teaching now and then maybe not have a job for the spring contract. I would encourage us to either work somehow with UJ to get those names and, potentially make sure that we're recruiting some of those folks. Maybe you've thought of that already. It just seems like a no-brainer to me that we would reach out to some of those folks because they may not be looking for full-time employment quite yet, if that makes sense.
Yeah, I think we're very fortunate to have the University of Jamestown for a lot of different reasons as a partner in our community. So any way that we can use staff, we would be happy to do that.
Any other questions, Rob? None? Okay. You finished with your report then? Okay. Moving on to Board Education, review and purpose of assessments. Joel?
Thank you for letting me share with you some information about assessment process in our district. Jennifer Young is our assessment coordinator. So since she's new to the district, I've been working with her and trying to get her familiar with our processes. She's very familiar with the assessment piece just because in her previous position she dealt a lot with assessments. Unfortunately, she wasn't able to make it here tonight, so you have to listen to me. So I sent a PowerPoint, so you should have a copy of the PowerPoint. So just a few things on that. Basically, we have 4 types of assessment. The first one being a summative assessment, which just is a one-shot, sort of at the end of the year or at the end of a period of time, looking at growth over a full year or a unit or something like that. Most of the time, we're looking at that's the ones that get the most attention for us because those are the things like state assessments and things like that. So those summative assessments are just a sort of a picture after the fact. Then we have interim and benchmark assessments. We utilize a interim or benchmark system where we benchmark our students in math and reading 3 times a year, once in the fall, again winter, and then in the spring. And that helps just indicate where they are, what kind of progress they're making throughout the school year. The third type is a formative assessment. And these are the ones that probably teachers rely on the most. Those are the more informal assessments that are given in the class. Teachers do them in a variety of ways, everything from individual check-ins to exit tickets at the end of a lesson, or just even class participation, checking to see how students are understanding things with a thumbs up or a thumbs down. Just, like I said, a variety of different assessments. And then the last one is the diagnostic. Diagnostic assessments are a little bit more focused on specific skills, and they give teachers information about how a student is doing in on a specific skill, and allows the teacher to then address any deficits that student might have, and it's more focused instruction because of that diagnostic piece. And of those, we're probably getting a little bit better. One of the reasons that one of the pieces that we're working on a lot is with our reading instruction is getting a little bit more focused on that diagnostic piece and identifying specific skill deficits earlier and addressing them. As far as district assessments, we have the North Dakota State Assessment, which is a summative assessment. It measures achievement in math, language arts, and science. Math and language arts is given to grades 3 through 8 students and students in grade 10, and that's done in the spring of the year. Science is done only at 3 grade levels, 4th, 8th, and 10th grade. Again, those are all done in the spring of the year, an online assessment. Last spring, we didn't have the state assessment because of the fact that we weren't in school, and requires secure browsers and all those types of things, so there was no state assessment last spring. We have been told that we will have the state assessment this spring, so I don't know if we're looking forward to that, but we know that that's going to be coming. Another piece of the state assessment is the North Dakota Alternative Assessment, which is an assessment given to the special education students with demonstrated need in that area. We can only use that as alternative assessment for 1% of our student population. So that's a limited number of students that receive that assessment. The next type of assessment that we deal with is the interim or benchmark, like I mentioned earlier. We use two different types of assessment here. We've had the STAR assessment, which is measuring math and reading in grades K through 12 across the full grade span of our schools. And we do that 3 times a year, like I said, in fall, winter, and spring. And a couple years ago, when we, as part of our Striving Readers grant, we were able to get a second assessment. There's a different assessment, different interim assessment, benchmark assessment called FastBridge. So we added that and piloted that to see what additional information we could get. FastBridge Suite has more of that diagnostic piece to it than STAR does, so we were interested in seeing what kind of results we would get with that. We've been piloting that the last couple of years at different grade levels. Last year we had 2 teachers at each grade level administer the FastBridge assessments to make a comparison between that and STAR to see what teachers' perception of the data they got back and the accuracy of that and everything. And so far we've been very, very pleased with that. So we'll be looking at that this winter actually and making a decision going forward about if we're going to stick with STAR or FastBridge and what that's going to look like in the future. The other summative assessment that is given is a NAEP, National Assessment of Educational Progress. That's given every other year to grades 4, 8, and 12. We have already been told that that's not happening this year. So they're not going to do a NAEP assessment this year, which was very well received by a lot of people. I know as a former middle school principal, the NAEP assessment was sort of frustrating because it's a measure of the data that goes in as a state level data. Schools don't get any information back. You don't have anything. It's just state data. The purpose is for just comparing states to states, and it's national and international. So it's not very actionable data. So it's sometimes we feel like it's you sort of lose that purpose when you're giving it. Then another assessment that we use is the Access 2.0. Access is a assessment for our EL students or English learner students. Any students that we have identified as English learners receive the Access test, and that is given in winter, January. It's a January-February window. And that is used to determine their growth, and that's a report that I guess an indicator that the state looks at as far as what that growth should be for EL students based upon their level, whether they're level 1, which is the most needy of the EL students, or level 5, which are those that are getting a pretty good handle on the English language. We also use that screener or that tool as a screener for any new students that come into our district that we suspect may have English learning as a second language or that may need English learning instruction. The high school is a little bit unique because they have a variety of other assessments at their level. They give the ACT in reading, math, English, science, and writing. That's all part of their Choice Ready. That's a state scholarship qualifier. Usually that's given in the spring of the year, typically in March. Then we have the ACT word keys. The word keys is, again, applied, the test areas are applied math, graphic literacy, and workplace documents. Again, another state scholarship qualifier, grades 11 and 12, more of a technical qualifier, and looking at that can be given whenever the students request that, and that's in grades 11 and 12. They just make appointments with the counselors and have that taken when they want to. We have the PSAT, which is the National Merit Scholarship qualifier, and that's given in grade 11, and that's usually done in the fall of the year. All of our AP courses, we have 4 AP courses, 4 areas of AP: math, English language arts, science, and social studies. Each one of those has an AP semester exam given at the end of each semester that allows them to, if they receive a certain score, they are allowed to get credit, college credit, for that. And then the AVSVAB. The AVSVAB is a military readiness assessment, and that's given to all of our 10th graders. And that test is usually in the spring. They usually try to do the ASVAB and the ACT at the same time because it involves those 2 grade levels, and they can set up a schedule where they have the high school, most of the students involved in some testing on that particular day. The last slide in there that I included was just a Choice Ready, the North Dakota Choice Ready graphic. It shows the different areas, the essential skills, the post-secondary readiness, workforce ready, and military ready, and some of the indicators that are used for that. This is the second, I believe it's second year for the Choice Ready, and as an indicator, and the first, actually the high school's done fairly well on that, but there's already some revisions being made to that. So there might be some changes to the Choice Ready program, but it's one of those that has been part of our ESSA plan across the state for meeting ESSA requirements. So just wanted to touch briefly on those and give you an idea of what assessments we do across the district. So if you have any questions, I'll try to answer them for you.
Heidi?
Joe, as far as the ACT, were we able to administer that last spring? And then will we be able to also have it this spring? Is that the plan?
I don't believe we did the ACT last spring. Good question.
The plan is, yes, they're looking to proctor as much of that as they can. And I'm not sure if ACT falls into this or not, but they're talking about the potential for electronic proctoring for some of that, which is not ideal. I don't know, like I said, don't quote me on the ACT being a part of that, but I'm part of the ESSA planning committee, and we've had that discussion about assessments, and that we might have to do like NDSA for the North Dakota State Assessment, the summative assessment. We might have to proctor that at home. Not ideal, but it's the best that we can do. We have responsibilities for 95% participation rate. That's really difficult when you are educating students in a virtual environment or at a virtual academy. That's really, really problematic. And one thing that Mr. Hagelin said that I want to touch on, I feel like I need to every time we mention ACTs, where I think the common thing for people to do is to benchmark. North Dakota's average is this, or the district's average is this. How does that stack up nationally or to Minnesota or whatever? And I just want to continue to reinforce, as I have to this board a number of times, that remember in North Dakota, a large percentage of students take the ACT. Either you take the ACT or you take the work keys. That's a responsibility. And that is not the same in every state. I think it's 18 states that are required to take a similar idea, either the ACT or work keys or all ACT is required. And so you're not comparing apples to apples. If you're only comparing 80% of kids to 100% of kids, that's not an apples to apples comparison. You're always going to see a slightly lower median when you are assessing all versus just 80%. And I always just think about, let's keep that in mind. when we're doing those comparisons as well as a state.
Bob?
Did I read someplace, or am I making this up, that colleges are looking at dropping the ACT as a requirement, or maybe that's just a short term?
Yeah, that's accurate. You know, one thing that's difficult about that is that the ACT still maintains for some staff or departments to be a placement test. So you might, it might not be required by the university, for example, but it's used for placement in certain courses. So it's still problematic to not have it. Even if it's not required, it's still needed. Although I would say institutions of higher ed could still suggest that it's taken in these circumstances. But even when they're not required, they're still needed.
Aaron, you had a question? Then Gail?
Just wondering which of these assessments would allow for some level of comparative analysis and assess the impact that the COVID has had on, the different learning plans and teaching the students?
Well, at the beginning of this year, one of the requirements for going back to school was that within the first month of school, we had to administer one of our interim assessments, our STAR Fast Bridge assessment. And the purpose of that was to see where students are and make a comparison to, where they normally would be and stuff. Well, that's pretty difficult. I know in general, and that was one of the things that the state had required, and we're still waiting to see what format that data has to be reported in. We run our reports, but we don't know what they want. But in general, we saw that our assessments for our students scored lower than they had in the previous years in the fall assessment. I mean, which just makes sense. They missed that much instruction. The hopeful thing is that we don't have any data to support it yet, other than the progress monitoring data. Some of our programs have progress monitoring data that goes with certain groups of students, but just in general, some of the information we're getting back from the instructional coaches I work with and from teachers is that, they've seen, even though the kids started off with probably not scoring as well on those STAR assessments or FAST assessments, that with instruction, those gaps have seemed to be narrowed fairly quickly. So really this winter, when we do our winter assessment, and at the elementary level, that's after the first of the year in January, we start that. That's when we can really tell what kind of impact that, the COVID at the beginning of the year and now what it's like getting back to instruction. I think elementary in particular it'll be really interesting to see that, because they have been able to go, face to face, and make up, and I don't want to say make up that time, but that instruction has been trying to close those gaps. So I think teachers in general at the beginning of the year modified instruction a little bit just to make sure that they were hitting the concepts and standards that may have been not addressed in the spring with absences with the COVID shutdown. But like I said, I think that our January benchmark will give us a lot more information on that.
Gail?
Just a question with the AP testing. It says at the conclusion of semesters, isn't it? I think it's usually just second semester, which is why you always schedule a one semester course. Because I think that's just or has that changed? I'm kind of triggered reading the whole secondary school stuff anyway. So.
Okay. I know it's at the end of their semester course, but I don't know if all those semester courses are. I don't believe they're all second semester, though.
Spring, after spring semesters,
Okay.
with national dates, but
Okay.
I didn't know if it changed after
Yeah.
COVID too, to catch
Like I
up
said-
on summer.
No, it hasn't changed.
Okay.
Nothing's changed
No.
thus far.
No.
Yeah, I just was,
Yeah, that could be in, real honestly, I have not dealt with ACT a lot.
Well, I'm still trying to forget.
Any other questions for Joe, or?
Okay,
None? Okay, thanks for coming, Joe.
thank you.
What's that? Oh. Any old business? Hearing none, we'll move into new business. Nothing under activities. Getting into building and grounds, can I have a motion to approve the MOU for the Jamestown Regional Medical Center for short-term disaster shelter? Motion by Gail, seconded by Bob. Any discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Heidi?
This is the same thing they do every year,
Yep.
every other year, yeah, okay.
We have
So
nothing.
yes,
in-
it's,
Oh, go ahead, Rob.
sorry, it's every other year we do a review. We entered in this agreement for the first time 2 years ago, so this is our first review. We didn't make any changes. Actually, I still kept the misspelling of my name. I didn't remember to change that, so.
Moving into curriculum, we have nothing. Finance, there's nothing. Personnel, could I have a motion to approve an extended contract for Pam Schmiedemeyer, salary of $1,161.97 for .02 FTE for PE section for 2021 school year. Motion by Heidi, seconded by Melissa. Any discussion? Hearing none, assuming roll call vote, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving into policy and procedures, can I have a motion for the approval of the second reading of North Dakota Comprehensive Model School Policy for Tobacco Use, ABBA? Motion by Aaron, second by Jason. Any discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving to letter B, is I'm going to have a motion to approve the first reading of the tobacco-free policy violations, ABBA-BR. Motion by Bob, seconded by Gail. Any discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving to letter C, can I have a motion to approve the second reading of summer school policy, GACD? Motion by Gail. Second by Aaron. Any discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving into tuition, can I have a motion to approve the tuition agreement for a ninth grade student to attend Medina Public School for the 2021 school year? Motion by Bob, seconded by Melissa. Any discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving to letter B, is there a motion to approve a ninth grade tuition agreement for pre-K Jamestown students to attend Pingree Buchanan Public School for the 2021 school year? Motion by Melissa, seconded by Aaron. Any discussion? Jason? Oh, sorry. Yep, approved 9 tuition agreements.
Nine pre-K.
Yep. Thank you, Jason. Thank you.
Yep, 9
Thank you.
pre-K.
Yep. Any other discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving into other, A is a set the school board retreat meeting. Can I have a motion to do that? '21st.
Oh, retreat was January 4th was my recommendation.
Yep. Yep, okay. Motion, a second? Seconded by Bob. Any discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Is there a motion to revise the board meeting schedule according to Rob's recommendation? Motion by Bob, seconded by Jason. Any discussion? Yep. Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Moving into the instructional plan review, is there a motion to accept the committee's recommendation? Heidi?
Make a motion to accept the committee's recommendation of continuing in instructional plan 2.
Okay, is there a second? Seconded by Aaron. Any discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Any items for future agendas?
Are
Yes, sir.
is the retreat agenda full? We still looking for things, or?
If anybody has anything, just let me know and we can see what, if there is anything that we can add to.
Okay, and if there is something that comes up for future meetings, just let Rob or myself know, and we'll try to get that on the agenda. We have meetings to be scheduled. We have a special school board meeting Monday, December 21st at 5:15 in the Thompson Community Room here in the middle school. A regular school board meeting on Monday, January 18th at 5:15 in the Thompson Community Room in the middle school. Moving to Roman numeral 6, just remind everybody to right-click. Heidi?
Mr. President, the SEEC Southeast Education Cooperative will have their governing board meeting on Wednesday at 11:30. The meeting will be over Zoom, and there's information on the website as to how to
That
connect.
this coming Wednesday, or?
This coming Wednesday, the
This one?
9th, yes,
Okay.
11:30 a.m.
Okay, we'll add that, and then Roman numerals, Bob?
Are we having a health insurance committee meeting on the 14th? 21st, right? 21st.
I believe it's on the 21st.
Okay. I've got 14th on my calendar.
Okay. Then it may be asked to change that time. So I think it's 14th.
Okay. Okay. Jason?
I just have a question on the communication committee. That's not is that a public meeting? Is that one noticed in a public meeting or no?
I believe that it needs to be yes.
Okay, moving to Roman numeral 6, remind everybody to right-click on your superintendent's evaluation, evaluate Rob for the meeting, and then also to right-click on our adjournment to assess our meeting. No further business, meeting's adjourned.